All right, we're going to call Health and Human Services Committee to order. Are we? Maureen, I've got the iPad up. I don't know if, do I need to? Probably not, unless we want to look at the language of the resolution. Or anybody wants to go into detail of the minutes? Okay. So I'll do the minutes first before I forget. So I'm going to move to approve the minutes of the Health and Human Services Committee held January 2023, without the necessity of a reading. Do you have a second? Motions are made and seconded. Any discussion? All in favor? Aye. Opposed? Motion passes. So next we have the communication from Director Leininger and Assistant Director Boss, which was actually teeing us up for the conversation we had last Health and Human Services Committee meeting. So I'm just going to move to receive and file this communication because we're going to end up talking about the next resolution. So, move to receive and file. Second. Motions are made and seconded. Any discussion? All those in favor? Aye. And that motion passes. All right, so now we're to the real reason we're here, which is the resolution to form the Community Health Needs Assessment Standing Committee, possibly yet to be named something snazzier if I get my way, which I might. So I'm going to, Director Langer, Assistant Director Boss, do you want to tee this up for us?
So, thank you, Madam Chair. I guess I put together just some notes to kind of walk through the resolution
Sure.
If you're interested in.
Yeah.
And so I guess just from an introductory standpoint, the resolution is intended to formalize and kind of enable the next step. And I think we view this as a long-term effort on behalf of residents. I've mentioned on a few occasions before, this is a continuation of the work started with past efforts like Live Well Lakewood, Active Living Task Force. I actually found in a search for something else this past week, I found Live Well Lakewood documents from the mid-2000s. So it's been around longer than just the 2019 effort. I love as you continue to peel back the layer on the onion for some of these things. And so it just adds more credence, I think, to those things that in talking to those groups and other organizations of continuing to formalize this cross-sector collaboration and continuing it to go or to move forward so this action plan just doesn't sit on a shelf. Primarily among that is to capitalize on the partnerships that we worked and forged through this most recent effort to really move forward on the resident identified priorities, get those moving into implementation, which really I believe starts to build and sustain that culture of health action that people have been talking about for a decade, if not more. So this resolution is, I hope it's straightforward. It's fairly similar to other committees and task forces and organizations that have been stood up in the past. The first section just identifies, kind of the upfront, the duties. I think there's three that I'll just primarily highlight. I mean, the first is to advise and recommend, and that's to council, to the mayor, to the administration, leadership, and other public and private entities. And that really, our first order of business right now is to work through those priorities that are contained in the action plan. And there's a whole host of them, and that is going to be the meat of the work, initially for this group, is to take all those priorities, and then you really need to start doing an implementation assessment then of like easy, hard, those types of things, so that you can really start to bend. You get it on a quad chart. You have kind of the high and low priorities from the community, and then you have easy and hard in terms of implementation. And so you can really start to time phase all of those actions over, going into the future, identifying the necessary organizations and partnerships that may or may not exist or need to be forged or need to be effort. And so that's really that advise and recommend piece, because some of the things the city controls, some of the things the school can control, but a lot of it there is going to be other entities, and that's where we talk about, you know, the necessity of other public and private entities that are related to health needs, because a lot of this we don't control, but and we'll get into the membership a little bit, but what we do control is a lot of it is the connections between the actions and potential resourcing. And so I think that's a critical piece to this. The second duty is, you know, to promote general improvement of partnerships, programs, and other initiatives, and those are done inherently through that advise and recommend and the actions. And then the last one is to encourage education and investment. And I think that's part of that is to continue to beat the drum on the importance of this and building and sustaining that culture, and continuing to keep it moving forward. The second section identifies the organization. So we've kind of leveraged a lot of the experience of the last CHNA and action plan effort, in that we had a steering committee and we had an advisory committee. We recognize that I think the kind of the manageability and the consistent membership of that we used through the steering committee was probably the best model for this. We did consider kind of starting, you know, right off the bat with a larger group that we had in our advisory committee, but recognize the fact that we're, you know, inherently you're going to kind of work through these, because they're organized that way, the actions through each of the different areas in the social determinants of health. And there are so many organizations in Lakewood and connected to Lakewood and regional organizations that have different roles and responsibilities in each of those areas. You don't need to get a commitment from every single one of those groups to attend every single meeting and work through every single action, because you will burn them out very quickly. And so what we did is we kind of used that steering committee model to come up with a core membership of 7 seats, basically, that are organizationally determined, that's manageable, it's consistent, but it represents a broad overarching responsibility across all areas. That there are organizations that touch just about every single one of those. And then as you get into, you know, the management of that core membership and the leadership of it, you know, in terms of a chair and a vice chair and those things, the important thing to note is that the city's not obligated to lead this. We may end up leading it initially just based on with the partners and leading it through the CHNA and the action plan, but that's not the idea long term. The idea is to start to hand off that leadership to some of these other organizations. The committee is intended to be expandable, just as now we're looking at, you know, how we ran the advisory committee during the CHNA and the action plan. It grew and shrank as we needed through that, you know, 16-month effort. So that kind of proved that concept. And as I mentioned, it doesn't obligate organizations to continually participate and get burned out. But we also cap it at 21 members so that it's manageable, and you kind of recognize that. And that's based on our own experience and ability to manage that group. And so when we're looking at these different areas of economic stability and education access and quality, you know, neighborhood and built environment, that there are inherent different organizations that we will kind of invite, call in based on our experience with the advisory committee. We have an established relationship with a lot of these organizations, and we'll bring them in to kind of, again, pick up those priorities where we left off during the assessment and the action plan, and now let's work on carrying them forward. And so those are, they're organizational seats that are kind of managed by that core steering membership, those 7 members, which includes a council representative, 2 from city schools, and then 2 from the administration, and then the 2 partner foundations. And so that's the basic organization. It's meant to be, you know, there's consistent, there's continuity in that core membership, but it's expandable and it reacts to the needs of that advise and recommend, encourage education and investment, and promote general improvement. And I think that's where we saw a lot of success in that advisory committee, is that we were able to leverage those organizations and their connections and their volunteers and folks to make the assessment and the action plan kind of build upon itself and kind of, you know, spider out into the community, where we wouldn't have been able to do that just as a smaller steering committee. Section 3 discusses, and this is consistent with other groups and task forces that have been. You need, we recognize kind of a need with this organization to request agreements via the city. So if I envision this as a long-term investment, a long-term organization, at some point, the assessment, the health needs assessment may need to be updated. Hospitals do it every 3 years. I'm not envisioning the city needing to do it every 3 years, but maybe 5, 10 years down the road, or 7 years, whatever it may end up being. That's an example, just an example that comes front of mind for me is that, this should be the body that kind of organizes and works through the city to contract the next assessment. We had to do a pickup game in May of 2021 to kind of organize the steering committee really quickly to get an RFP drafted, reviewed, out, and then we leveraged that steering committee to go through the natural selection process, but it worked out very well. So this committee, we envision that as it will serve that purpose just like it did earlier, serve it well, but we need that ability to request agreements through the city. Section 4 is, we need to have something to kind of work towards every year, and that's an annual report to kind of, to really quantify, what we've done, what we intend on doing, and that kind of keeps us accountable to the administration and council. And then Section 5 is the dissolution provision. So recognizing that at some point it may not be necessary, and that is kind of it needs to be a collective conversation between the administration, council, and the committee itself. So if it's not achieving what was envisioned to be achieved, or if another organization or a partner foundation or someone is able to kind of pick this up and carry it off in the appropriate direction in the future, then that can happen at that point in time. And so those are the basic sections. I think, and we have drafted this currently as an emergency resolution. We discussed that just based on the need to kind of get after it and get it moving without the continued readings and stuff in the future. There is, 16 months spent on an assessment and an action plan. This has been, I think, the effort itself has been heavily engaged, and the community's been heavily engaged in this. And so I think when we talk to most organizations, they want us to get moving on this. And so that's kind of the crux of the argument behind that. So I think pending questions, those are my notes, I guess, to kind of run through the resolution. And I recognize we have Kate's here from Healthy Lakewood Foundation, and we also have Mark and Lisa from the City School District as well. I don't think Kristen was able to join us from Three Arches, but offered them the opportunity to comment as well as needed. So that's all.
Thank you. And thank you to our guests for being here. I think it's, and I've tried to wrangle, or I have in my past lives wrangled community organizations to try to work collaboratively, and it's not an easy feat. So we want to keep this momentum going as long as we can. I know Councilman Rader had a question, and then Councilman Marks, if you have questions. So Councilman Rader.
Thank you, and certainly this is something that I support and will be supporting whenever we decide to refer it out. The one comment I have is to that Section 2, and maybe just to get your thinking on this. I do see the 7 members of the committee, which make perfect sense to me. They're the decision makers, the funders, people who have the influence, who are the experts on this. And then, there's this larger group of advisors that's going to be formed. I kicked this around in my head. I looked at this before we was introduced the last meeting. I wasn't at the last meeting in person, but I was thinking about asking this then. But y'all gave some really good answers as to that Section 3 on how we're going to fill in the gaps. But I came back to it in my head, and I might as well just ask, is there any thought about codifying additional members now that may be more representative of the community? Like, I'm just thinking of Lakewood Community Service Center. I'm sure they were in the mix or were on the slate. They represent a very specific group of individuals in our community that none of those entities fully represents, though certainly we all fund, the different programs within there. But we're all, that entire group, except for maybe the the school district, or some of the school district representation has a much broader look at the health space, whereas I think it may not focus a lot on underinsured. That group doesn't really represent specifically underinsured, doesn't represent folks that are of lower income. And we know through the study that there's a lot of folks that are making those very hard decisions between food and healthcare and things like that. So I'm just wondering if you can get a little bit into the philosophy as to why we wouldn't include somebody at that codification level who could represent that kind of the public who we're serving rather than just the decision makers.
No, it's a good point, and I think, and if I showed you the original resolution, like draft one of this is like, I think this is 4 point something. I actually had, I think we had 21 some seats like named out. When we went back through it, and then we actually, and Kate was the one that started writing on the board, started going through the different areas of social determinants of health and trying to, align groups and organizations in terms of, the areas that they serve. It started to get we started to see kind of a consistent, and that's where we kind of landed with the 7 and the core membership. You see some core organizations. This is not, I recognize that, I guess this is kind of hard to, we recognize through the assessment and the action plan effort, those existing organizations that are out there that will participate in, in this committee moving forward. I think it's very hard to codify that into the long term and list every single organization. I guess at my word, we're not going to be an exclusionary by any means in terms of when you're digging into these specific issues. That and when you look in this to call under section 2 or under section 1 in duties and B, when we talk about the following authorities, we're not. It was very intentional to not limit the ability to call on subject matter experts. So there may be organizations that we know have a public facing or a front role in terms of a specific area or social determinant, but that also doesn't, and so they may be on the committee for that, the consideration of those action periods, but that also doesn't limit us to calling other people in other organizations. I think it's important to recognize that, intending this to be a long-term, hopefully, resolution that plays out in the manner that we intended to over the long term, and I won't even define the long term, but we don't know what we don't know at this point either about other organizations that may develop, grow, mature, be stood up. And so I'm hesitant, and I think we were kind of as a group then hesitant to formally codify organizations and bin them into areas or social determinants that it may limit them, frankly, in the future in terms of their contribution, and we don't want to do that. So we want to retain, I think in this effort, retaining as much flexibility as possible is important. And so I think that was our overarching intent.
Yeah, I think your philosophy is very clear. And I could see too where do you draw the line then? Then you get to that 22 number because you're really trying to check all those boxes. I guess I'll just leave with one thought to the committee. I still feel pretty strongly that, I trust that it'll happen, but maybe even with our appointment, that there's somebody that is struggling somehow represented at the very highest level with their health needs, whether it be someone that's specifically a senior citizen, trying to live on a fixed income, or somebody that, maybe in the disabled category somehow. Having that perspective, I think, is irreplaceable. And I have full faith and trust that they will exist and they will be a part of the discussion. But, we're just talking about the fine-tuning of that codification layer. So that's all. And thank you, Mr. Did you have a...
No, I would just say, I think that was part of the discussion of ensuring that a council representative was included in there as the natural kind of, elected representative of the people. It's we had discussions about, do we need to include a resident from every ward? Is there and we certainly can, if that's the direction that that the committee wants to take in the future, but it's always not, we don't want to bake in anything that may make it harder to manage, but we always retain the flexibility to adjust it, call in experts, call in other people, and so we try to make it as flexible as possible.
Thank you, Mr. Bass. Thank you, Madam Chair.
Councilwoman Marks, did you?
Thanks for all your hard work on this. I'm real impressed with this document because I was involved when I was last on council in the Live Well Lakewood. And we had several meetings, but it kind of petered out because we really didn't have a resolution. So I love this. I love the passion in which it was put together and your thoughtfulness about it. And I think it will evolve over time, certainly as we get into this and see where our needs may change. But I love the representation of 7, and I think it's really a great job. So thank you for doing this and working so hard on it. And I'm excited to see this play out over time.
Councilman Baker, did you have any questions or concerns? You wanted
No questions or concerns, but this is pretty exciting, and I want to thank the planning department and all the stakeholders. One area that is kind of corresponds with my kind of interest is the neighborhood and built environment part of it, and I'm sure the planning department's representative will really dig into that. But I know there are a lot of good research on like what social infrastructure does to health outcomes and providing places for people to kind of have social outputs and social continuity. And that's where just as our discussion, it sounds like there was some discussion about how the committee can grow organically. And that's where some of the social infrastructure piece comes from organizations like Lakewood Alive, where they can bring people together for meaningful social interaction. So thanks to the planning department, thanks for stakeholders. Really excited about this.
Yeah, and I'll just, I'm all in on this, obviously, but I'm excited too because, in January we passed the Poverty Awareness Month resolution, and I remember to Councilman Rader's point about LCSC and their work, and Trish Rooney said, let's not just pass a resolution recognizing that poverty exists, let's do something about it. And poverty obviously being one of the main social determinants of health, and some of the economic stability elements, housing stability that came up in the community health needs assessment, the stressors we heard about. Some of us heard about a recent meeting on our community members of color, of our LGBTQIA community members. So I think this is just an incredible opportunity for us all to finally capitalize on all these really decades of desire of our community to come together and work on these problems. And to the point about the potential of, I think was it section 5, about the potential, like once we've solved all the health problems in Lakewood, then we can dissolve the committee. But if we're not being effective, we can also give that up. And I just, to Councilwoman Marks's point about carrying this work through, I think this really is a good example of why it's important that we codify this work, so that we have in the report coming back to council each year, although of course we'll have a council member on the committee and who'll be hopefully reporting back to council and involving council in that regularly. But the annual report will also be an accountability measure to make sure that we are following through on all this work. So I think this is incredibly well thought out. I really appreciate everyone's work on this. Would any of our guests like to speak? Ingersoll, Lisa, Mark, anyone? You don't have to, but I'd welcome the opportunity. You took time out of your night to be here. I want to make sure you have a chance to speak if you'd like to. So, all right. So, no one. Okay. Okay. We've said it all. We're all in. Okay. All right. So I am going to move to recommend this for adoption to the full committee, to the full council.
Second.
Motion's been made and seconded. Any further discussion? All those in favor? Aye. Opposed? And that motion passes. And there's no more business before this committee, so we are adjourned. Thank you.